Hello. So my today's topic is route of drug administration. In the route of drug administration, there are many ways of how we can insert the drug on the body. So in the route of drug administration, one topic is the intramuscular route, which I have to cover in this video. So, what is intramuscular route? So, first, the definition of the intramuscular route. It refers to the administration of the drug by injecting it directly into the muscle tissue. It allows the medication to be absorbed into the systemic circulation through the rich blood supply in muscles. Means by the injection, we have to give medication to the muscles directly by the using of injection. So the body will absorb or the muscle will absorb that medication by systemic circulation by use of blood supply in the which area of the blood muscles we have to provide the medication. Now, the purpose of using the intramuscular route is to administer drugs and not suitable for the oral intake. The person who is not able to take orally, who is not able to take drug orally, for that type of person, we have to give intramuscular route. To deliver long-acting and report preparation means the in intramuscular route, the acting of the duration of the drug will be long-lasting for faster absorption than oral and subcutaneous routes. Means that in intramuscular route, the absorption of the drugs will be so high except other than the oral route. Means in oral route, the absorption of the drug is so slow, but in the uh, intramuscular route, it will so high. Used when for excess, it's not feasible. Now, the common site of intramuscular injection is the deltoid, vastus lateralis, ventrogluteal, and the dorsogluteal. The location of deltoid is upper arm. The volume range is 0.5 to 1 ml. The common if it's for the vaccine. For the vaccine, we have to give at the deltoid area for the vaccine only. In the vastus lateralis, at the lateral thigh. The volume of the drug is 1 to 3 ml and preferable in the infants and child. So in the small kids or the infants for that patient, we have to give the intramuscular in the vastus lateralis location. Ventrogluteal is the side of the hip. The volume range is 1 to 5 ml and at the safer fever nerves and the vessels. Like we have to check first the nerves and vessels, and for the subsidation of the breaking or any subconscious of the breaking of nerves, so we have to give the ventrogluteal at the side of the hip. Now the dorsogluteal, which is the location for that is upper outer quadrant of buttocks. The volume range is the 1 to 5 ml and not preferable due to sciatic nerve risk. Means the if the experienced doctor will not give the intramuscular at dorsogluteal, then the chances of sciatica will occur. And so lots of other unconscious will occur if the sciatica will occurs to the patient. Now, the equipment which is required for the intramuscular is sterile syringe and the appropriate needles, and the alcohol swab and antiseptic solution for the gloves, dressings, and the sharp disposable container. So this is the equipment which is required for the intramuscular drug route. Now the needle selection. Needle selection is like the length of the needle. The length of the needles is usually 1 to 1.5 inches, means the 25 to 38 mm. The gauge is the 21 to 23 G, depends on the patient age, body mass, and the muscle mass. We have to adjust the needle length. Now the procedure. First, we have to explain the procedure to the patient and about constant. Now, and the second one is the we have to wash the hand and wear the gloves. Third one, we have to draw the medication into the syringe and remove air bubbles. Position of the patient comfortably to expose the selected side means the site we have to give the intramuscular by the injection, patient is have to completely confident to expose that particular area. We have to clean the injection site using the alcohol swab in the circular motion. So we have to clean that particular area by using the alcohol before we have to before we injecting the injection. Insert the needle at the 90-degree angle into the muscle, means the at the 90 degree of the angle we have to insert the muscle into the muscle directly. The aspiration, optional depending on the guideline, means this is the completely optional things. If the guideline has, if the vaccination, we don't have to give the vaccination, that it's completely uh, agree that we don't have to give the aspiration. Inject the medication slowly and steady, means after injecting the injection on the particular muscle, we have to inject the medicine slowly by slowly and steady. Withdraw the needle, apply gentle pressure with sterile gauze. Means after completing the medication or the we have to give after completing the medication and the medication goes to the patient body, we have to withdraw the needle slowly out. Now the dispose the needle safely and in the sharp container. Means in the sharp container we have to dispose that particular used needle so the infection will not spread from one patient to another patient. After that, we have to document the medication, dose, site, and time. So after injecting the injection to the patient by intramuscular route, we have to document the medication, dose, site, and time. The advantages of the intramuscular route is the faster absorption than the subcutaneous route or oral route. It is suitable for oily and irritating substance. Allows administration for larger volume up to 5 ml in some muscles also. Means that if the person will take oral drugs orally, the chances that the absorption will be slow, and the amount of absorption or the administration of the drug will so low. But in the intramuscular route, it will go up to 5 ml in some muscles also. Useful for departments the slowly release formulation. The disadvantage is the pain and discomfort at the injection site. After we have to give the injection at the particular area, the discomfort and the pain will feel by the patient. The risk of infection or other care is if not done as expectedly. Means the infect chances of infection is there if the patient or if the therapist will not give properly treatment, then the infection or is chances of infection is so high. Possibility of nerve damage means if the trained doctor will not give the injection to the patient or any other doctor will give the injection to the patient, the chances of that the nerve damage will be so high, or the patient will may also suffer from sciatica. Not suitable for the patient with muscle atrophy or bleeding disorder. The person who has bleeding disorder, that type of person we should not give the intramuscular route. The complication of the intramuscular route is infection at the injection site, nerve injury, hematoma, muscle fibrosis on repeated use, abscess formations. This is the complication which occurs in the intramuscular route. The example of the drugs which we basically simply used in the intramuscular for the vaccine purpose, hepatitis B, tetanus, influenza. This is the vaccine. This is used in the vaccination purpose. And antibiotics, penicillin, streptomycin. This will use by for the hormones uh, procedure. The progesterone and the testosterone will use the vitamin B12 also given by the intramuscular antipsychotics for the depot formulations. This will give in the this is the examples of drugs which is given in intramuscular. Thank you. That's all which I should cover the intramuscular route in pharmacology for the route of drug administration. Thank you. I am essentially Hitansu from second year B physiotherapy. Thanks a lot.